Hello and welcome everyone. You're tuning in to another MEDtalkx radio show. We're broadcasting it live on YouTube, so please venture over there to get clear evidence that we look better than we sound. So we are also on Facebook, so if you do search for MEDtalkx, that would be great. So we've got a stellar lineup today, but you can certainly ask us questions through our usual social media channels as well as through our radio. So over to you, Fahim, to introduce our guests.
Thank you so much, Mehran. My name is Fahim, for those of you who aren't familiar with me. I'm really delighted that we've got two experts in the field tonight. We're talking about digital health. And tonight we have Dr. Ayesha Rahim, who is a consultant psychiatrist and deputy medical director, as well as a clinical lead in technology. Welcome to the program, Ayesha.
Hi, thank you very much for having me tonight.
Excellent. And also Dr. Hussain Ghandi. Dr. Ghandi is a general practitioner and also a primary care network director and creator of eGPLearning, a fantastic website. Please do check it out. And host of the eGPLearning Podblast, and also a nationally elected member of the RCGP Council. A warm welcome to you, Dr. Ghandi.
Thank you for having me.
Excellent. So let's dive straight into the subject matter for tonight. If I can start with you, Dr. Ghandi. Tell the audience, the listeners and viewers, what really is digital health?
Digital health, it's got various different definitions, but effectively it's about using technology to try and enhance either the flow of health or obviously improve your health itself. And there's various different forms of this, and there's different ways that you can look at it. But there are different experiences patients will have with it, whether it's something as simple as the most basic form, measuring something like a thermometer, you could call that digital health. But actually what we're now seeing is more the different ways that we access health systems. So things like online consultations, video consultations, telephone consultations, that side of things, as well as more advanced stuff. And we're even going to see things like virtual reality, augmented reality, and that kind of stuff hit us soon as well. So it's a broad topic, and I'm hoping we'll be able to kind of demystify a little bit for you today.
Thank you so much. You mentioned consultations, and to give an overview to people watching and listening, we're hoping to cover the different types of consultations tonight, how to access healthcare effectively now and in the future, accessing medical records and notes and the differences in care, and also the apps. Everyone likes an app, so how to choose the right ones, as well as keeping safe in the digital world. So there's a really jam-packed show. Just want to continue a further question for you, Dr. Ghandi. Obviously told us a little bit about digital health, but what makes it so exciting to you? I know you're very passionate about this topic, and why should the audience really get interested in this topic as well?
Well, I guess the best way to describe my personality, I'm a guy who likes to fix things. And I've always been the kind of person that loves technology, even from way back when I was a little kid. I loved my video games, I loved TV, I loved anything that was just electronic and tinkering around with it and stuff. But then when I started going through medicine, I kind of realized that actually there are ways that technology can help us. And that can be, like I said, all the stuff about how you access health or monitoring or gadgets and that kind of stuff. But even just simple principles about workflow and that kind of stuff, and how that means that a patient gets from A to B, and how can that process be improved either for the patients or for the clinicians. And particularly it's the clinicians where I tend to spend a lot of my time. But there's also a lot of stuff that can be done to help patients navigate the crazy system that we have to deal with.
Great. And Dr. Rahim, if I bring you into this discussion, so what's your relationship with digital health, and could you tell us a little bit more about your role as clinical lead in information technology?
Yeah, sure. So I think I've got to roughly the same place as perhaps Hussain, Dr. Ghandi, but from the opposite direction. So I would say I'm not a techie person at all. Still struggle with some forms of technology in my day-to-day life. But what I am interested in is how we improve care for patients, because we try and get it right all of the time. We don't always get it right all of the time in making sure that patients have access to the best care at the right time in the right place. So that was the first thing that sparked my interest. How can we improve the experience of getting care for patients? And also from the staff perspective, how can we help our staff to make their lives easier in delivering that care? And so that's how I stumbled across the digital health world, I suppose, because digital technology is just one way of improving healthcare, and it's all around us. We use technology in many other domains of life. Many of us do our banking online. You might do your supermarket shopping online, book appointments online, So health is also something that is lagging a little bit behind, and I think there are some really good reasons about that, which I can talk about later. So that's my interest. So we need to make sure that health gets right up there in terms of its use of technology to improve patient care. So in my organisation, I'm the clinical lead for technology. So I link in with staff members on the front line, nurses, doctors, occupational therapists, physios, to try and understand what would make their working lives better. I work with patients as well to see from the patient's perspective what would make your experience of getting care better. And I also link in with our digital teams, those are the technical, clever people who actually build our systems that help deliver great care. So I suppose I'm sort of like the bridge in between all of those groups. That's how I see my role.
Fantastic. So clearly lots of hats and lots of responsibilities there. But when we think around COVID and what it's meant for the digital kind of the mapping, do you feel we're ready in terms of the infrastructure and are we well equipped to handle digital health in the future?
So yeah, COVID has obviously been an awful global thing that's hit everybody. It's affected everybody in some way or other. And what it's forced us to do is to get ready. So there were lots of things going on before COVID happened in terms of the use of technology, and that was going at a plodding pace, I suppose. But suddenly when COVID hit and we had patients who were unable to leave their homes because they were ill or had been in contact with somebody who was ill with COVID, or we had staff who couldn't physically go into work because they were ill or because they were in contact with somebody, there were lots of people in their own homes. And actually, when you're delivering a healthcare service, normally you deliver that face-to-face with people, generally speaking. So COVID forced our hand, and we had to make some radical, drastic action immediately to try and make that work with everybody working from home or being at home to receive care. So I have to say I'm really, really impressed by how people really got to where they needed to get. Our digital teams were absolutely brilliant at getting all their resources into focusing on being able to deliver care at home. Our patients were up for the challenge as well, because we wanted to improve their ability to still access care. So even if you need to stay at home, you're still entitled to healthcare, and we need to make sure that you get it. So our patients worked with us, and our frontline staff, they adapted. So we achieved a lot. It's been hard. There's still a long way to go, but we've made such great progress in the last 6 months from that perspective, and it's made us better as a health service, but there's a lot more still to be done.
Excellent. Dr. Ghandi, you talked about the different types of consultations, and I know you as a GP, you were probably one of the first to actually got onto this model. You knew about remote consultations in a lot of detail before many other doctors, I would say. I mean, how have you found the transformation of the different types of consultations?
I think we've seen obviously radical change happen over the past 10 months or so. So as Aisha mentioned, COVID came along, and it is the absolute biggest disruptor we've seen in our generation. And as a result of that, we had to change the way we did things. And prior to COVID being there, things like online consultations and video consultations were seen as a nice to have. These were things that could potentially help with accessibility, but it wasn't the preferred way of doing things because a couple of reasons. One, it was different. Two, the technology to do it. But more importantly, it was the system changes that needed to happen to allow practices and patients in particular to use them effectively on a mass scale. COVID kind of changed that, because as a result of it, obviously now we had an issue with people being in the same room. It became a problem. So many practices were told back in March and April that actually we need to move to something called a total triage system. And at the end of the day, general practice deals with 90% of the healthcare contacts in the NHS. So patients got a radically different kind of service. What total triage basically means is, rather than you going to the practice and then speaking to the doctor after, booking an appointment and then explain what the problem was, that the practice kind of got that information beforehand in whatever way that was. And that could be either an online consultation, which many people probably see as like an email style consultation, as a telephone consultation, to have a discussion with the clinician. And then sometimes that would end up being things like a video or other kind of routes and things. And general practice has learned how to do that a bit better. Everyone has had to learn how to do that better, but also with the right shift we've seen with patients in terms of more people using things like Zoom and other kind of platforms and that kind of stuff. Patients are actually feeling a bit happier using these kind of methods to have a consultation. So if we talk about the different types, as I said, there's online consultations like an email or discussion, think of it as a WhatsApp chat in a sense. That's the most basic version you can think of. The second one, as I said, is telephone consultations. And that's actually probably where most people are now having experience with primary care, because actually that's the way you get most of the information the quickest and the easiest. And then if we need to see a patient, do we then need to bring them down for a face-to-face if it's safe to do so? Or could we do that through a video consultation? And a lot of people thought this was going to be the panacea. This was going to be the thing that, you know, everybody would be moving towards. But we've actually realized that video is good for certain things. It's definitely not good for everything. And then I guess there's two more that many people may not have come across as much in that way. But one is what I like to call the photo consultation. So that's patients being able to send in images or other kind of stuff to doctors, and also being able to send them back as a way of communication. And then the last one, which is I think the one we're going to see the most growth in the next kind of 5 years or so, is group video consultations. And I guess that's going to be a real game changer, I think, for many patients, particularly with things like chronic disease management, particularly since we're still stuck in this, you know, COVID world and things. Those are your main kind of consultation types.
Excellent. And Dr. Rahim, in terms of obviously the different types of consultations, what have you found in terms of the psychiatry look? Obviously, it's a complete different skill set to general practice, obviously assessing so many different kinds of mental health. I mean, how do you think it lends itself to that?
Well, I think there are probably lots of things that we have in common with primary care, because, of course, most mental health care in this country is provided by GPs. So the likelihood is if you have a mental health condition, your first port of call is going to be your GP. But when your illness is of that level of severity or complexity, that's when perhaps you might come to a service like mine in my organisation. And actually, there are quite a lot of similarities there with general practice. So we offer telephone consultations quite commonly. We offer video consultations, but of course, there's no substitute sometimes for having a face-to-face. So the real thing that is important to get across is that while we aim for a digital first service, because we want people to stay safe and be able to access care, we absolutely know that sometimes there are barriers for people in using digital forms of communication. And those barriers can take different forms. So, for example, you might not have adequate Wi-Fi. And actually, if you don't have adequate Wi-Fi, it doesn't matter how good your device is. If you can't reliably connect to the internet, a video call just isn't going to work, really, and it interrupts the flow of the conversation. So we might then choose a telephone consultation, for example, or a face-to-face, depending on the clinical situation. So yeah, if you don't have Wi-Fi, that's a problem. If you don't have a device that can connect to the internet, for example, now most people do, but some people don't. So we've got to take that into consideration. And also, if you don't feel confident in your skills, then that can be a barrier to accessing that type of healthcare via video as well. So basically, we offer all the three main types of service: video, telephone, and face-to-face. We try for video first, but actually nobody is disadvantaged if they cannot or do not want a video consultation. So it's all about keeping options open and making sure really that people get the care they need in the most appropriate way for them.
Fantastic. We've had some comments coming through. This is from Ayaz, just asking, will this be available on demand? Absolutely. Please do go onto our YouTube channel. You can just rewind and play it back again. But yeah, so there's lots of issues, isn't there? But I guess, does it offer an opportunity to improve efficiency? And there's also some talk, especially in primary care, that we should be offering more appointments because of the fact that we're going digital.
I think in terms of efficiency, there is definitely ways that digital can help us. So I mentioned about online consultations and particularly telephone consultations. But maybe, you know, even before COVID came along, there were many examples where I saw a patient and actually they didn't need to see me. What they needed was something else sorting. Like, for example, I used to have patients who came in for a consultation just to get a prescription, you know, one of their regular repeat prescriptions. And whilst that's maybe important to the patient, that's not the best use of time, because actually I've not really done anything apart from click a button and print it off and send it off to the pharmacy. You know, there are other examples about doing administrative stuff instead of clinical things. And at a time when we are short of GPs, when we're short of, you know, clinicians to help people, what we want is to make sure we're using that time effectively. And also from the patient's perspective, it's really frustrating having to take time out of your day to go see the GP for something that actually you don't necessarily have to physically do that for. And don't forget, we're adding in all the stresses that come with going somewhere physically. So my biggest one for most things is parking. And I can assure you there's many people out there that have the same frustration, that trying to get somewhere, find parking, and then go to the appointment. And no, I hate it. So that's why I love the opportunity that tech can bring us in that kind of way. And I think, you know, that's something that we're going to see hopefully improve as time goes on.
Yeah, I think there's lots of evidence that meetings are better attended, educational opportunities are better attended, there's more engagement, and obviously efficiency that way. Dr. Rahim, there's obviously a strategy about personal healthcare record. How easy is it for an individual in the public to access their own personal information in terms of their health records?
Yeah, so I'm going to come back to that in a second, but just kind of following on from what Dr. Ghandi was saying, actually, when you talk about the efficiencies that video consultations and electronic consultations can bring us, one of the perspectives that I'm aware of is that I work for an organisation that covers the entire county of Lancashire and South Cumbria. So we have a really, really broad geographical patch that we can cover. So there are benefits and efficiencies for staff and for patients. So the parking is the obvious one, of course, but the big travel distances between patients' addresses. So traditionally, a lot of visits were done at home by staff to patients' homes. And so if you think about the time that is lost when you travel in your car from one place to another, if your appointments are digital, it really cuts down some of that travel, which is really fatiguing for staff, but also for patients. Obviously, there's the parking issue. But if you've got an appointment that clashes with the school run as a patient, and you've got a clinic appointment, or that clashes with the morning rush hour, that in itself is anxiety provoking, worrying if you're going to get to your appointment on time. And certainly in the mental health service, anxiety is such a common feature of the people's difficulties that we see. If you're already anxious, if you're then trying to fight through traffic, trying to find a parking spot, how much worse is that coming in person? And the other thing is, of course, that I see lots of patients that really struggle to get out of their houses for anxiety reasons as well. And what that does, it makes them not feel like they can come to appointments. And therefore, they end up being excluded because there hasn't been a realistic alternative to face-to-face appointments until very recently, really. So the fact that these remote consultations, telephone consultations, video consultations are becoming so much more mainstream now, it means we are able to offer people a service who perhaps wouldn't have accessed it before. So it's actually making sure that people are more likely to get the care that they need. So I just thought that was a really important thing to think about as well. But yeah, I can say a little bit more about the accessing records, if that's something that...
Yes.
I can add
yeah, go on back to Ghandi.
Yeah, no, you're mentioning about the anxiety elements, and that's definitely one that I think where we've seen a buy shift in a sense. So clearly, I think there's people that have become more anxious about the way that video consultation, telephone consultation, that kind of stuff run, and therefore feel less engaged with it. But like you said, there's also a significant proportion that felt more engaged and that the care has become more accessible. And another one is simply the waiting area. You know, I have so many patients that physically wouldn't come to the practice because they'd have to stand in a waiting area surrounded by other people. And that's the thing that triggered them. Or even, you know, their mental health issues meant that they were potentially marginalized by other people. And, you know, unfortunately, we would love to say that we can see people bang on time when they arrive. We all know that's not the reality. And just having to physically be in that waiting area was a real challenge for those patients. And even if we try to put things in to mitigate it, it was still never a great experience. Whereas being able to offer them remote consultations and saying, actually, we can deal with most of this if that's appropriate remotely, and only having to bring them down when we're saying, actually, this part we do need to see you face to face because there's certain things we just can't do in any other way. At least it took some of that pressure off them, and actually their health outcomes have actually improved as a result of that. So definitely a key point.
Yeah, 100% agree, because actually I think when you talk about digital health and health technology and video consultations, for some people it can provoke an anxiety response, and not just from patients but also in professionals as well, saying, well, actually not everybody can get on with digital, and that's okay, we recognise that. So it's not about saying that digital is a complete substitute for face-to-face. It's in addition to traditional means of consulting with people. It's not an either or, it's an and from my perspective.
Excellent. So Dr. Rahim, let's come to the medical records bit then. If you want to actually mention a little bit about how you think medical records are accessed at the moment and what will be the future.
Yeah, so this is something that I feel quite passionately about, actually, because as a patient, we give a lot of our information, obviously, to healthcare providers, but actually it's about us, so we should own that data. Now, there are legal mechanisms by which you can request to see your notes, and you just need to make the request. Often in writing is what's requested. to make sure that you're the correct person. You're trying to access your own records and not somebody else's. So the ability to access your records has been there for a very, very long time, but not very many patients have been used to doing it. Certainly not in my field of practice, in secondary care services, in specialist care. But one of the really exciting things about digital health is that actually we can make that process much easier. So it's not necessarily just an on-demand thing that you have to go through certain hoops to find your records so you can be informed of your own care. Actually, there are ways and means that organisations are starting to explore, so that by default, you kind of sign up, your identity is checked in a very secure way. But once you have that channel of information, then actually you should be able to see key information about yourself. And I know that general practice, Dr. Ghandi, you can tell me that general practice is way ahead of secondary care in this domain, but it's something that specialist services are trying to keep up with as well. So I don't know, Dr. Ghandi, do you have experience of your patients accessing their health records quite often?
Yeah, so we do. So general practice has contractually been required to offer patients access to their medical records for ages, but in terms of prospective access, so moving onwards, that was written into the contract as of April this year. So what that basically means is that if a patient wants access, they can have access. As you said, there is a process they have to go through, so unfortunately it's not going to happen the day you ask for it, partly because the clinicians have to make sure that those notes are appropriate and safe to share, and that there aren't stuff like third-party information and other people's data, and potentially in certain situations as well, there may be concerns about things like safeguarding or other kind of information that it is not in the best interest of the patient to share. Now, that's quite minimal and only on the grounds of safety, but once that's done, that does mean that that person can have access to their information. Now, can that be around having a record of their consultation so they can refer back to that? Absolutely. Does that mean that then they can access their results without having to call the practice or contact the practice to check, are my blood results back and that kind of thing? Again, absolutely. And does it mean that it potentially can help patients have better control and ownership of their own healthcare? Absolutely. The concept about the medical information and not being able to understand it, that's something that may need to be accepted because, we still use that to document all the information we have, and there may be stuff on there that doesn't make sense. But generally speaking, a lot of it is, put in a way that hopefully the patients can understand. And I think there is absolute benefit from patients having it, as long as they understand the implications of what having that data is, and the security and the safety of that data needs to be paramount. That's the big thing. Yeah. I think one of the really positive things I'm hoping we'll see is, like you say, is actually the collaboration between primary care, so us in general practice, and the specialist services and secondary care, because that's where I think the biggest kind of problem often is. It's that sharing of information, having that work effectively, and actually patients being the center of that does mean that hopefully that process works a lot better. So particularly those patients with complex health needs, secondary care services and that kind of stuff, actually they're the ones that probably need that information the quickest, because then they can manage their health a lot better.
Yeah, absolutely, 100% agree. Again, I mean, it's really interesting because when you speak to patients, in fact, speaking to my family recently, I was trying to explain what it is I do for a living apart from the doctory bit of my job, the technology bit of my job. And I think when you work in the health service, you obviously understand how it works, you understand the different organisations, but from a patient perspective, everybody thinks of the NHS as one big organisation. You can all see every organisation's notes. GPs can see specialist information, specialists can see GP information automatically, and if you go to a different part of the country, all those records link up. It doesn't work like that in practice, and it comes as quite a shock to people that that's the case. And that's even if you're in the same geographical locality. So, your GP practice might be next to a hospital. That doesn't mean anything in terms of the records linking up necessarily. Now, thankfully, we are starting to see a big shift in that. So certainly in my neck of the woods, again, Lancashire and South Cumbria, we have what we call a shared care record. So it's a platform that allows the different hospital organisations in the area to share information on a secure database that also the GPs have access to, the Mental Health Trust, my organisation, key bits of information about patients that we can all tell from each other's records. And actually, this is about patient safety. So the example that I give is that if I'm seeing a patient in my clinic, in a community-based clinic, sometimes they will come to me, and particularly my old job when I was working in the General Psychiatry service, they would say that, oh, Dr. Rahim, I've seen a heart specialist a couple of months ago, and they started me on a new tablet. And I would ask them what the tablet was, and very often the patients wouldn't know or they couldn't remember, which is understandable. And that would have big implications for their mental health treatment, because some of the medications that I need to prescribe as a psychiatrist might interact with heart medication. So if I want to be able to treat somebody safely, I absolutely need to know the list of all the patient's medications so I can make that choice safely with the patient if that's what the patient needs and that's what they want. So in the old days, what would happen is that I would see the patient in my clinic, they would tell me this story. I would then have to say, it's going to take me quite a while to find out what your cardiologist prescribed, which is crazy, really, isn't it? So I'd have to say to the patient, I'm really sorry, I can't prescribe the medication that you need today. Go away. Let me do some digging. I'll either try and get hold of the heart specialist letter, either from the heart specialist or more easily from your GP, again, which is ridiculous. And then I'll have to bring that patient back to my clinic when I've got the next slot on my waiting list, which might be a couple of months down the line. And only then would they get their treatment, once I've been able to make sure that my prescribing was safe. That is an unacceptable delay for patients receiving care. But because of our new shared care record, what I can do, if the patient comes to me and says, Dr. Rahim, my heart specialist has prescribed me a new medication, I can go onto the shared care record. I can look at the cardiology letter, the heart specialist letter. They will have written what medication they've prescribed. And I can do that when the patient's in the room with me as they're telling me, and I can get a prescription sorted out immediately. And actually, that's what it should look like when things work well. So again, we're still making sure that that system is maturing and getting even better, but it is a million miles better than it used to be in the old days, like I described.
Excellent. I just want to mention at this stage that the NHS UK does have advice how to access your health records, whether that be your GP records, your summary care record, for which you'd need to speak to your GP about. And so it's really quite clear there how it's done. And during the coronavirus outbreak, there will also be extra information added to your record at the moment as well. So just for people to be aware. Dr. Ghandi, I mean, in terms of this, there's also the safeguards that need to be put in place. We've talked a lot about exchanging care records, but confidentiality is an important tenet, is it not, of the records? And can you tell us a little bit about how that's maintained for some of these medical records so they don't get into the wrong hands?
Absolutely. So confidentiality, is one of the key parts about healthcare, that the information that patients tell us is used appropriately for their healthcare benefits and not shared with anybody and everybody. And I guess that's one of the reasons why, although the shared care is a really positive step forward, actually the best way is the patient being the center of that. Because actually, if you have the patient as the center, all the concepts about how to share the information and stuff, that's shared with the person that it's relevant to. Now, GDPR, which I'm sure everybody has heard of, purely and simply because of the impact it had a couple of years ago, that radically changed the way that organizations do share information, because it made it even more keen to make sure that there was no problems, no errors, that kind of stuff. And I think that has scared people sometimes a little bit about what's appropriate to share and how to share it and that kind of stuff. So that does sometimes create friction. But actually, like I said, if you've got the patient as the center of that, then the confidentiality aspects and all that kind of stuff is, to a degree, almost a moot point, because it's the patient's information. It's the information that they hold, and they get the choice of who they share it with and when. So using Dr. Aisha's example, if the patient had that information on their device, for example, and they said, actually, doctor, here it is, I'm showing you, that's the consent to say, actually, here's the information, and that can work, just as effectively, just as quickly. I think in terms of making sure that information is shared appropriately, whenever somebody asks us for information about a patient, we will often say, okay, well, we need to know who you are. We need to confirm why you're asking that information. Is it appropriate to share that? And often people can understand that. I guess one of the things I often see as a conflict with many patients is, for example, if a relative of a patient has contacted the practice saying, I want to know what's happening with my relative. Well, actually, unless we've got permission from the original patient, we can't share that. Even if you're the partner of that person, if you're even the parent of that person. Okay, children is a slightly different situation, because there are different rules around that. But that's sometimes an issue that does cause people concern. And once you have the opportunity to explain why that's the case, and you just need to confirm a couple of pieces of information first, and possibly even go back to the index patient to say, actually, are you okay for me to share this information? It's fine. But I guess it's important to recognize that the reason we do that is to protect the confidentiality, is to protect your data and make sure it's shared safely and effectively. And that's whether that's with other people or other organizations. So even when we share that information with hospital teams, we will still check to make sure it's definitely going to the hospital, not some random, Nigerian email address of a prince trying to take £20 million off you and that kind of stuff that we've seen. So
yeah. nice little hypothetical situation there.
I'm sure we've all seen those emails where you've won
Yes.
£10 million, and they just need your email address and everything else to confirm it. So yeah, making sure we get it to the right place.
I know, absolutely, and we know that those in the vulnerable groups seem to be targeted by default more so. So that's that's where the safeguarding and risk management is even more important.
Yeah. And that can be quite difficult. I know sometimes relatives get confused and struggle with that and are quite upset by those rules and regulations in place. But I suppose it's a little bit like banking. If somebody rang your bank, if your spouse rang your bank and or your relative or family member, the bank wouldn't give out your banking details and the details of your transactions to that person. They would go through you, wouldn't they? So it's a bit sensitive data, isn't it? And actually, it's about making sure, exactly as you were saying, Dr. Ghandi, it's the patient should own that data. It's about the democratization of data, and that's something that's really important. So yeah, you're right. I mean, a shared care record is just a bridge on the place where we need to get, and there are some really good examples of that in Estonia, for example. Their healthcare system is completely digitized, and the patient decides who sees their records, and that's actually where ideally we should get to.
And is it fair to say, Dr. Rahim, that there is a national opt-out option where people can actually choose what they want to share information? I don't know if you can tell.
Yeah, so I don't. It's not something that I come across greatly. Of course, every NHS organisation has to publicise this, and also to make sure that people understand the pros and cons of things. So, absolutely, patient privacy is really important, and you are the ultimate arbiter up to a certain point about where your information goes. But I guess its main application, or where it mostly gets transacted, is in primary care, because actually primary care is the main interface that people have with healthcare. So I don't know, Dr. Ghandi, if you've had more experience in practice.
Yeah, I think there's been different levels of opt-outs and opt-ins. So there's, like you mentioned, there's a summary care record. So that's the one about sharing key parts of your medical information with other organisations, like, for example, hospital services, that kind of stuff. There was various other ones, and unfortunately the names just the care.data one, so that was about a few years ago, and that's about using your medical information for research, which may sound like a positive thing, but part of that was we were unsure who was actually doing that research, and was it for medical research or was it for other types of research and things, and that was, again, one of the opt-ins, and it originally was an opt-out and then it became an opt-in. But I guess in terms of sharing information, patients sometimes get really confused with this because there are about 5 different types of ways that you can share information. It's important to recognize that sometimes we have to ask patients this because it's appropriate to do so about the safety of their data, but also sometimes it can cause challenges. And I guess the example I'll give you, in my practice, I work in inner city Nottingham, and we are a practice that don't do, for example, our own ECGs. We have another provider that does those ECGs, those heart tracings for us. Now, in order to share the information with that organization so that we can do that, we have to have a share agreed between us and them so they can access the essential stuff like the patient data, the name, date of birth, all those kind of things. And obviously, so then that information can come back to us. If the patient doesn't agree to that, actually, I don't have a mechanism of arranging an ECG for them because I can't send them anywhere else apart from send them to the hospital, which sometimes that's not the right option because that's the worst way for that to happen. So it's recognizing that it is about privacy, but it's also understanding the depth of that privacy and what it's being used for, making sure that it is being used appropriately for patient benefit, and challenging that when it's sometimes misconstrued.
Yeah, and I think it's important, isn't it, to make that distinction between medical research and research, as you say, for possibly commercial purposes. Now, the NHS does not sell its data, its patient data, to any commercial enterprises, but actually having anonymised patient data. So when you collect data about groups of people without attaching that data to individual people, is an absolutely fundamental way of improving medical knowledge, research knowledge, so we can get better treatments for people. So we know which treatments work for which type of people, which demographic section of the population. So yeah, whilst sometimes there is a bit of wariness around that, people need to also realise that research is often done on population level. So your name doesn't get attached to your data. It's just the actual medical bit of it. And we pull that data together to develop those insights, to get effective treatments and get better research and get better care ultimately.
Yeah, and maybe now's a nice time to talk about apps. I guess we can't avoid a conversation on digital health without NHS apps or any other apps. So I'm going to start with yourself, Dr. Ghandi. It's a good way of engaging the audience, but what would you say about NHS apps?
And I think people have had different experience of apps. So many people will probably come across the Test and Trace app recently in terms of COVID, and whether that's been a positive or a negative experience for them obviously does vary. I think in terms of patient-derived apps, that there's loads, first of all. There are many options you could explore. I think if you're looking for valid apps or apps that's sensible for you to use for your health, there's a couple I would definitely suggest exploring. So number one is the NHS app itself. And I would recommend a lot of patients look at using this. And now the experience you have will vary depending on how your local area has managed it and also how much involvement your practice has had with it. But at the very least, it can allow you to register with your practice, look at the medications that you have on a regular basis, and you should, in normal circumstances, be able to book an appointment through the app as well. Now, because of the whole total triage thing that's happened recently with COVID, that is slightly different. And some practices may not use that to allow you to book appointments, but that is a function that's there. Does allow you to do a lot of other stuff as well. So you can choose your organ donation preferences. You can even access your medical information through that app if you want to. So there are some places, like, for example, in Nottingham, where using the NHS app is the kind of doorway into accessing your medical information. And that can work really, really well. So that's probably the big one, I would say, to most patients. There are more, but I guess I can pass over to Aisha to see if she's got any particular that she would recommend first.
Yeah, so I suppose, the growth in health and well-being apps has just sort of skyrocketed exponentially. All you have to do is to look on the Apple Store, the Google Play Store, and if you put in health and well-being or some variation of that phrase, you will come up with thousands and thousands and thousands of apps. So I guess the first thing from my point of view is, as a healthcare professional, is I worry sometimes, how do I know that my patients are accessing, or how do you know as a patient that you're accessing something that is actually going to do what it says it will do in a safe way? Because there is no rule really about who can develop an app and who can get it on the Play Store or the App Store or wherever you get your apps from. So one thing that's really, really important is that the NHS has something called an NHS Apps Library. And if you just Google NHS Apps Library, you'll come up with the website. So what happens, it will take you to a website and you can actually filter by type. So, for example, if you want an app to help you with insomnia or stopping smoking or your mental health, for example, it will bring up a list of curated apps. So these are apps that have been assessed by the NHS or organisations working with the NHS, and they have to reach a certain barrier and a threshold to get on that library. So it almost does a bit of quality checking before it's allowed to be on the apps library. So it will check things like clinical safety. Is it a safe app to use? It's not going to ask you or tell you to do something dangerous with your health. That's really important. It will also check whether the app is treating your data in a proper way. It's not going to sell your data on without your knowledge to some kind of commercial company or whatever, or it's really, really clear and secure about how it stores your data. So that's really important. It will also assess how technically reliable the app is, because when you download it, you want it to work. It's a pretty fundamental thing, isn't it? And anybody can put any old thing on the App Store. So having a curation and list is really important. And it also will look at whether the data collected when the app could theoretically link in with another healthcare system, because that can be important as well. And then finally, it also assesses how easy is the app to use. Is it accessible for people that might have some kind of visual impairment or dyslexia, for example? So if you go to the apps library, you click the type of app or the subject of the app that you feel is helpful for you. You at least have some kind of assurance that what you're downloading has passed a basic threshold for quality. And I think that's really important. So what I would say to people is, if you're wanting to download an app, great. Managing your own healthcare, really important. We encourage it. I would suggest going through the apps library, because you've got that little bit of a guarantee then, haven't you? So that'd be my top tip there.
Excellent. And Dr. Ghandi obviously talked about apps in itself, and you have your own channel and so on. There might be people listening and watching today who want to get involved and think, well, remote learning is here and we're not having face-to-face for a while. Why can't I just set something up in my own room somewhere and start a channel and things and get involved in this whole digital exodus? Can you give some tips for them?
So just can I clarify, do you mean like starting a YouTube channel, or do you mean about apps and that kind of stuff? Sorry.
Just actually get involved with the digital revolution, and they want to get involved and actually learn more about this sector in the way that you've got involved. Yeah.
Because that's kind of what we're doing at the moment, isn't it?
Yeah, exactly.
Yeah, sure.
We've modeled ourselves on you.
No, I mean, I think there's different ways of getting involved. When we were talking about the apps, actually, there was one point I did want to make quickly, if that's all right. So Aisha mentioned about the Nhs App Library, and it's an amazing resource. For the clinicians out there, I would actually suggest having a look at a slightly different resource, and that's something called ORCA. So that's the Organisation for the Review and Care Health Application Care Health Applications. And they are basically the organisation that actually does the legwork for the Nhs App Library. So they're the ones that actually do the assessments. And the best way I can describe it, they're an organisation that basically does what the BNF does for prescriptions and for medications, but they do that for apps. So as Aisha mentioned, they do the evaluations and that kind of stuff. But also they have a system in there that allows you to prescribe those apps to patients as well. And using simple text message interface, so you can send it to the patient's mobile phone, they get all the details. And if you wanted to, you can even have it set so you can track whether or not the patients are actually using the apps as well, as in have they downloaded it. You can't see any of their data, be very clear on that, just simply have they actually opened the link and downloaded the app. But that can be really useful in terms of looking at engagement and how effective things are. There are some really good apps out there. And particularly, I think with COVID, we've seen the increased use of that for particular things, health and well-being, and particularly mental health and well-being. We've seen a lot of use of apps in particular. So things like Headspace, Calm, Daylight, those kind of things. I often describe to patients a really good starting point for dealing with, elements of anxiety, low mood, sleep disorders, that kind of stuff. And the benefit of that is they get access to it there and then. They don't have to wait, which is often part of the challenge that, patients may have a challenge and feeling a bit anxious and they just need some additional support. And I say to them, this isn't a replacement for therapy, but it's a good starting point to help you get towards the place where you need to be. And sometimes even gets people to in that mindset that actually this is where therapy is going to lead me if that's what it means to help them. And as well, it's instant, which is great. So I just wanted to make that point. I think in terms of, if patients are wanting to look at, getting more involved with health applications and how to use digital health, the first place to have a look at is just have a chat with your practice. See what kind of resources and opportunities that they have for you. Are they involved deeply with the Nhs app, or is it just a case of registering and all you get is access to your repeat medications? Which that in itself can make a lot of time a lot easier. And many practices don't allow patients to request their medications over the phone because it's not safe. So actually doing it electronically, if you happen to remember at 10 o'clock at night when your practice is shut, and being able to do it on your phone, that's a lot less stress for you rather than having to try and get in at 8 o'clock in the morning to ring to say, I need my prescription and that kind of stuff. Whereas actually that process can happen in the background. I think the clinician... Go for it, sorry.
No, go on. I was going to go to something else.
I was just going to say, if for clinicians, if you want to get involved in the understanding of digital health and stuff, there's some really good platforms out there to help you. You're more than welcome to check out mine. It is more focused for clinicians themselves. But I do also have some stuff on there for patients. So my favorite one for patients is simply a video that shows patients how to take a photo of the back of their throat that they can send to their GP. Because like I mentioned, a lot of clinicians now are using things like photo consultations to help understand how to help patients. Looking down the throat is considered something called an AGP process, aerosol generating procedure. And as a result of that, actually, we have to use different types of PPE to see patients who are looking down their throat. And often all we just need to see is a quick picture of it. But taking a decent photo of the back of your throat, it's not as easy as it sounds, to be honest. It's a dark area. And you want it in focus, not focusing on the lips, which is what most cameras will do. If you put a phone up to your mouth, you want it focused on the back of the throat. So making sure that photo is taken effectively just means that actually you don't have to go see the doctor just to have a look down your throat. They can give you clearer advice. And particularly since using that with my patients, I've only actually needed to see about 3 patients to actually have a proper look down their mouth. And that's because they've not had a phone with a camera on. And that's the only reason why. because that video shows them how to do it so that we get good images and we can give them good care without worrying them, to be honest. Sorry, Dr. Rahim.
No, that's fine. What you were saying about getting patients involved just sort of triggered another thought in me, really. And I was just thinking about, we ask a lot of patients in terms of getting used to new technology. And, you know, as healthcare professionals, we might be very much used to using this on a day-to-day basis, where a patient might only have a consultation with a healthcare professional every now and again. So we're always really keen for patients that have used technology, for example, like a video consultation, to feed back to us, actually, how have you found it? Now, I know the video consultation platform that we use in my organisation has an inbuilt questionnaire where people can feed things back, but actually we need to hear the positives and the negatives of people's experience, because that helps us to provide a better service, to know whether a particular form of technology is really working for people or whether it's actually causing more problems for people. So please do feed back to your healthcare team.
Excellent. We have lots of questions coming in near the end of the show, as is their custom. So let's try and get through as much as we can. With more use of technology, which is only going to increase in the future, what about all those who are not tech savvy or have issues using technology? What plans are being put into place for them, if any? I think, Dr. Rahim, can you take that one?
Yeah, so this is super important. So the phrase that is on everyone's lips at the moment is digital exclusion. So those are people that are excluded from, or the potential for people to be excluded from receiving a healthcare because of the introduction of digital. It's something that as healthcare professionals, and particularly those of us working in the digital health space, are really, really keen to avoid, because actually everybody deserves a service, everybody's entitled to service. And if digital is not for you, if it's something that you struggle with, then that will not be a barrier, it should not be a barrier. So if, for example, you're given a choice of consultations by your healthcare provider, you can, choose. Sometimes you give the option of video or a phone call, or sometimes a face-to-face as well these days, but less often as a routine first offer. If for whatever reason you can't engage from a digital perspective, you will not be denied a service, and nobody's going to say, well, we're not going to take up a digital appointment via video, therefore we're not going to give you a service. And also the second point to raise about that is that nobody gets put down lower on the waiting list because they choose not to use video. So I want to make that really, really clear. And it goes back a little bit to what I was saying previously, that digital should be a way of broadening out access to healthcare. It shouldn't be a way of putting barriers in front of people. So the idea is that we've introduced digital, because we've had to because of COVID, but also it's there to offer choice to people. So again, I work in a big geographical area. My patients sometimes struggle to travel. I see pregnant women, so I'm a perinatal psychiatrist. So often women have families, they've got kids, people are in lockdown, it's really hard for them to leave the home. So by offering a digital alternative, that helps people access. And that's the kind of principle that we're working to. That said, there are many different other barriers to receiving or being able to engage in digital way, and that partly will be your skills. So there are certainly organisations that offer skills courses as well for people that want to increase their digital skills and increase their confidence. So that's something to be aware of as well. There are sometimes big infrastructure issues. So there are some rural populations, rural places that have really bad Wi-Fi connectivity. The internet infrastructure is really poor. That's something that's obviously out of the scope of what a health service can solve. That's more a big government issue, and there's a lot of talk, isn't there, about rural communities and making sure that they're linked up. So I think things like writing to your MP, as simple as that, and actually flagging up that this is causing disruptions potentially in you being able to access healthcare. I think there's a really important message that perhaps we can offer to the people that are in the positions to solve those problems, because it's no longer an option. So when you move house, you connect your water, your gas, your electricity, whatever. Actually, internet is up there as a utility now. How do we get on without internet? It should be a basic utility and considered as such.
Sounds like almost a basic human right, the way you've described
it. Absolutely.
Dr. Ghandi, there may be a question you can take. People are saying about, can apps diagnose or provide a better medical service than face-to-face consultation? I guess you could break that down into, what your understanding is of the artificial intelligence, perhaps in some of these apps, and whether they're going to replace you and me in the future, I guess.
So I don't think apps are going to replace us at all. And I think the reason why that is because at the end of the day, the interface that you have with them is based off the information that's put in. And if they can't process that effectively, then you're always going to get a weird answer. And what do I mean by that? So that there are a couple of, AI-based health applications out there, and they are designed to be as safe as possible. So they will always go to the option that is safe. They may not go to the option that is sensible. And they are two different things. So, the algorithm may say, oh, you've got a bit of chest pain. Chest pain equals go to a hospital without any further kind of detail or information and that kind of stuff. Whereas we know as clinicians that chest pain can mean a variety of things. Yes, it can mean it's your heart and that's a concern and that needs to be dealt with straight away. It could also mean indigestion. It could also mean muscle pain. It could also mean anxiety. It can mean a lot of different things. And understanding that and being able to not only take the information from the patient, but understand what that means for the patient as well, in terms of the way they're even communicating that information, the tone of voice, the speed at which they're talking about it. Those are things that help us understand how much of a significance each part of that information is. Where I do think that technology will help us, though, is being able to understand larger packets of information. So things like managing results for patients and, the various different data points that you've got, bringing that down to something that the clinician can then use with the information we know about the patient and the information the patient's giving to us to come to a better decision and opening up the possibilities of what we may need to do. That's where I think it will help. So I don't think AI will replace doctors, but I think doctors that use AI will replace doctors.
Yeah,
does that make sense?
Yeah.
It reminds me a little bit of what Ali Parser said. Now, Ali Parser is the chief exec of an organisation called Babylon Health, which, of course, has entered the primary care market, and they have a couple of different options. I saw him say something once, which was really profound. He said that actually AI or those kinds of intelligent apps might help along with your healthcare, but what they can't do is to put their hand on your shoulder and tell you that things are going to be okay. That's the human aspect of healthcare that's really important not to lose sight of.
Yeah, I think we can all kind of reflect on reading ECGs and how those automated responses are. Medicine is just as much art as opposed to art, certainty, isn't it? So that's where the dynamic of the consultation really kicks in. We've got some more questions coming up, and I guess that one of the key things over the past decade, if not more, is just about empowering the patient, and the internet has provided a good platform to allow people to search their symptoms, trying to understand what could be going on. One of the questions is, how trustworthy are medical websites, and are there any specific ones that you recommend? And you can't say Google.
So the best thing about the internet is that anybody can put anything up there. The worst thing about the internet is that anybody can put anything up there. Yeah. So my first advice to people would always be to go to the NHS website. But you've got symptom checkers there, you've got a COVID symptom checker there too. And so you really need to be careful about the sources of the information that you go to, because just simply typing into Google, anything could pop up. So my first bit of advice really always start with the NHS website itself.
What are your thoughts, Dr. Ghandi?
Yeah, absolutely agree. So nhs.uk is, I would say, for many people, the first place they should be looking for online health advice. It's ratified, it's concise information. That's actually, they spend a huge amount of time making sure that information is easy to understand as well for patients, so they don't use long, complicated words or terms that may confuse you. They intentionally design that information to be suitable for patients to help them understand their health. I think there are other ones that I do tend to use as well for patients. So a really big one for me is one called patient.info, which is designed to give lots of really good, concise, additional information in terms of certain, a bit more depth sometimes. But that's not really the kind of website that you would use to check, your symptoms and that kind of stuff with that. That's much better with the nhs.uk website. But the patient.info one is a really good one. If I want to know, for example, dietary changes I need to make with gout, for example, they've got a really good leaflet that helps you understand this, and this is the stuff to have, this is the stuff to avoid, because actually that will make it worse and stuff. So that's the one I do sometimes recommend to a lot of patients.
Yeah, and I guess if you've already been diagnosed with a specific condition, then asking the person that's diagnosed you, have they got a website that they would recommend that might be a bit more specialist? That's another way of accessing accurate information as well.
Yeah, because the Royal College has got numerous leaflets with relation to mental health difficulties or management or medications, etc. So there's lots of information out there. As you said, Dr. Rahim, it's just asking that clinician, isn't it, taking that first step. The other thing is around keeping safe in a digital world, and I think we've kind of touched on that. But what kind of infrastructure do people need to have to be able to access digital health? Is it around antivirus? Is it around secure lines? Is it around making sure that there's a consent form updated? What kinds of things would you say?
So, I mean, from my perspective, one of the things that a lot of the applications and stuff that have the health information and things will also have processes designed to try and keep stuff as secure as possible. So if I mentioned the NHS app, that's a really simple one to use. But for example, that will time out after a few seconds if you've not used it, and it will require you to put in either your fingerprint, if you've got a fingerprint reader on your phone, or a password or something like that, because it's designed to try and keep things as safe as possible. In terms of virus checkers and that kind of stuff, you know, a lot of the apps, again, are designed to try and be as safe as possible. So they use encryption. So that means that in order to access that information, it requires a code that, you know, is really long and really complicated to try and decode that information. And that has to work. And that's one of the reasons why sometimes patients get frustrated as well with us, because we say, well, we can't access certain things unless the computers are working and the data's working, because otherwise we can't, you know, we can't unlock that key kind of code thing without having that stuff work effectively. I know, particularly for clinicians, it's a real frustration because we see what consumer tech can do, and then we want to try and do that same thing with health tech, but actually the security has to be there. And the best example I can give for this, and there will be people out there that remember this, about 3 or 4 years ago, the WannaCry virus wreaked havoc across the entire country because it specifically targets organizations, including the NHS. A data security flaw that happened meant that several places across the country had several days where they couldn't access any of the information stored in our computers. And that was an absolute nightmare. And that is one of the worst case situations because we just can't access information. And at the end of the day, patients' health, a lot of it is the information we have on them. If we don't have access to that, there's a limited amount that we can actually do because we need that information in order to help the person in a safe and effective way. And I guess that's one of the reasons why often people get really frustrated that health tech has all these extra processes in place. But that's the reason it has those processes in place, because if it goes, you're stuck doing nothing.
Yeah, I guess, Dr. Rahim, do you have any things, obviously, as a clinical officer, data breaches can mean huge fines for trusts and in secondary care. So, I mean, it's obviously can cost a big fine. And sometimes it's not malicious. It could just be human error, isn't it? So, I mean, what's your take on that and how do you manage that?
Yeah, so we have a whole set of systems, regulations, rules in place. And I know that our staff sometimes find it frustrating because they have to comply with so many different, what seem like hurdles and hoops. But the reason those procedures are in place is because mistakes happen. We are humans working in a system, and anytime you get humans, you get error. So the best we can do is to put systems in place so that we get people to check what they're sending out by email. Email can be a really common way for breaches to occur, so we need to make sure that people check what they're sending out. We have a really important policy which is about telling people if there's been a significant data breach of your data as a patient, we have to let you know because actually it's your right to know. And then what we also do is we report ourselves to the person that's in charge of data security, not just for healthcare, but for all of the types of data, the Information Commissioner's Office. And so it's a matter of good practice that if we made a mistake, we put our hands up and say, gosh, we made a mistake, we're really sorry, this is what it caused, and this is what we've done about it. And then that's when they tell us whether they think our actions have been sufficient to reduce the risk of something like that happening again. So it's about giving confidence to the public. Actually, we take your data really seriously, and actually if things aren't done in the proper way, we don't just get away with it. It's not just brushed under the carpet. We have to do things about it. There's always an investigation that takes place. So it's about giving people confidence that we take it really, really seriously. It's your data. We need to care for it.
Excellent. I think that's a good way to come to near the end of the show. In time-honored tradition, we like to have 3 top tips or learning points from our guests. So, Dr. Ghandi, if there's something, if someone even if just joining in the last few minutes, should they take away from digital health?
So I guess first and foremost, don't be afraid to use the various digital consultations that exist out there. And if you are unsure, ask the practice or ask the service or ask the clinician to help you do that. A lot of them, the time, they will have effective ways to help you understand how to do that. And I spend a lot of time doing that with many of my patients. I will talk them through how to do a photo consultation or a video consultation. And actually, once they've done it, they found it's a really good way to help improve access for them for their healthcare reasons. Number 2, download the NHS app. I would say that across the country is one of the best ways to have access to valid information and potentially other things like access to your health data. And it is the doorway to that access of information. And many places we will see, hopefully, over the next couple of years, where you'll be able to access so much more information through that route in an effective way. And thirdly, if you find this is something that is really challenging for you, that it makes you feel anxious, that you're just not sure what to do look for the services that exist to help. In Nottingham, we've got a group called Connected Nottinghamshire, whose sole remit is to help improve the digital use of healthcare across our area. And they even run, for example, groups in the libraries to help patients understand how to access their, the apps and stuff, how to start registering on their practice. They literally have clinics, in a sense, where they would do that. Okay, right now, because of COVID, a little bit less so, but that's what they're there to help with. So there will be groups across your area that allow you to do that.
Thank you so much. I hope people aren't distracted by the fly that was just going around my room there. Dr. Rahima, your 3 top tips, learning points for people watching.
Okay, so first one, I'm going to be reassured rather than annoyed that Dr. Ghandi got there in before me, but absolutely don't be scared of technology. So it's quite normal to feel a little bit daunted if you're not used to using technology in that way. So ask for help, ask a friend, ask a family member. There may be somebody in your family or close by to you that does feel more confident, so ask their help, or of course ask your healthcare team. Secondly, if you have been offered a video consultation and you can't have a video consultation for whatever reason, if you don't have the Wi-Fi, if you don't have a device, or you don't feel confident in the skills, please don't go away thinking that you cannot get a service. You absolutely can. It just means that we'll provide the service in a different way to you. So I wouldn't want people to not access healthcare that they're entitled to because they don't feel comfortable or they can't access technology to do so. So that's top tip number 2. And third tip, I suppose, if you are wanting to download an app for your health and well-being, be that mental health or some other kind of physical health issue, go to the apps library. That's the first place I'd recommend that people look, and at least you can be a little bit more assured that you're downloading something that's of quality.
Thank you so much. Thank you to both of you coming. Mehran, can you tell us who's joining us next week?
Yeah, so next week we've got Dr. Dira Chowdhury and Dr. Quram Sadiq. So we'll be discussing the value, the importance of ADHD, not just in children, but including adult services. So it should be a really fascinating, insightful discussion. So see you all next week. But again, from Rahim and myself, I just want to really thank Dr. Rahim and Dr. Ghandi for sharing their time, the Tuesday evening, as well as their expertise. So thank you again.
Thanks for having us.
Thank you and good evening.